Hello, everyone. Welcome to our webinar on Medicaid school-based expanded access. First, let me introduce everyone. Our two hosts will be Lindsay Kimbleton.
Good morning.
And myself, Stephanie O'Connor. We both work at Kentucky's Department of Education on the school-based Medicaid programs. Next, Ms. Lucy Sinners from the Department of Medicaid Services is joining us. She coordinates the Medicaid school-based programs for DMS.
Thank you.
Last but not least, Ms. Thelma Hawkins. Ms. Hawkins is a branch manager at KDE and oversees the Medicaid school-based program. She will be assisting us with an application demo.
Good morning.
We encourage everyone to ask questions throughout this webinar so it can be most beneficial to your school district. There is never a bad question, so please don't hesitate to ask. All questions need to be emailed to the email address listed on the screen. They will be monitored and answered periodically throughout the presentation. We hope you will join us on this exciting adventure in Kentucky that will benefit the health of all students.
All right, let me share our screen so you guys can see our PowerPoint. All right, so let's get started. What is expanded care? On December 15th, 2014, the Center for Medicaid and Medicare Services, also known as CMS, sent a letter to the states issuing guidance in regards to free care. If you would like to see the 2014 letter, please refer to the link on slide 5. The goal of this new guidance is to facilitate and improve access to quality healthcare services and improve the health of communities. This guidance allows school districts to bill for services outside of the IEP.
What does this mean for Kentucky? On April 28, 2019, the Kentucky Department for Medicaid Services, otherwise known as DMS, submitted an updated state plan amendment, also known as a SPA, to CMS to include expanded access in Kentucky. CMS approved this state plan amendment on November 4, 2019. This updated amendment allows schools to potentially bill for services that are provided to Medicaid eligible students and are medically necessary. However, these services must be available to all students, Medicaid eligible or not, at no cost to the student. The link that we have provided will show you the approved state plan amendment for Kentucky. Please note that this SPA was retroactive to August 1st, 2019. Don't get too excited. Several conditions must be met in order for schools to bill responsibly.
One of the most common questions we are asked is how much money will our district make? This is a very complicated answer and will take a couple of years for the schools to get the full picture. While all of our time today will be spent on the school-based health service program, which is also known as the direct service program or fee-for-service, just remember that all three Medicaid-based school-based programs work together to give the schools reimbursement for their services. The direct service program is where the school district will receive the most of its reimbursement. You can expect to see 3 small amounts of reimbursement throughout the year from these services. The School-Based Administrative Claiming Program, also known as SBAC program, is the next program to receive the most reimbursement. And lastly, the cost report cost settlement.
Before we get started explaining the ins and outs of the school-based health service program, let's give a basic overview of the other two programs. The School-Based Administrative Claiming Program, more commonly known as SBAC, operates using a time study methodology. As one of our vendors always says, the SBAC program are the bookends. The direct services, such as speech, OT, and PT, mental health, are the books. And the time spent before and after the services is what makes up our SBAC program. This program allows the schools to get reimbursement for administrative activities such as Medicaid outreach, Medicaid service, program planning, and policy development. Just a reminder, this program provides school districts with quarterly reimbursement. Also, please know that the SBAC guide will be updated for the upcoming school year to include our expanded access portion of the program. We'll give more details and trainings on these changes in the upcoming school year.
The cost reporting cost settlement started with the 2008-2009 cost report. This annual process ensures that the schools and DMS settle to cost. The cost reporting cost settlement is the final piece of the puzzle and ties everything together. So let's break it down and see how all these programs work together. Sally Jones, an SLP, has been providing services to kids within the district. Every time she provides a Medicaid billable service, Medicaid gives her a small amount of reimbursement. Her district receives $5,000 for her direct services. Her district listed her on the KDE annual application and listed her in the direct service staff pool list in the random moment time study. The following year, it's time for the district to complete the annual cost settlement. KDE supplies the cost settlement vendor, otherwise known as Fairbanks, a list of all the practitioners included on the direct service staff pool list in the random moment time study. Since Sally was listed correctly in the direct service staff pool list, her name appears on the school district and can count her cost. That fall, the cost settlement shows that it actually cost the school $10,000 for her services, and they only received $5,000. So Medicaid gives them a check for the additional $5,000. Now let's reverse it. Sally Jones has been submitting claims each time she provides a Medicaid billable service. The school receives $5,000. They forgot to include her on the direct service staff pool list in the random moment time study. So the following year, her name does not appear on the cost settlement and they cannot count her cost. Now her district owes $5,000 back to Medicaid. It's just an important reminder to always include all billable practitioners on the direct service staff pool list in the random moment time study.
Just to let everybody know, we already got our first question, and they asked if we would share our presentation, and we will. We'll give you a link where our presentation will be uploaded. Okay, the school-based health services. Last but not least, let's talk about my favorite program, school-based health service program. This program, for me, is the easiest to understand. Basically, if a Medicaid eligible child receives a service such as speech, OT, mental health, then the school may be able to submit the claim to Medicaid for reimbursement. The school should be receiving small increments of monies throughout the year from this program. Make sure to check out your remittance advice on Kentucky HealthNet. This is a receipt for all of your claims submitted and should be checked frequently. Your billing agent should be able to help you with this process. Please know that this webinar today will focus on the nuts and bolts of this program and hopefully give you a clear, basic understanding of what the expanded access program will look like in Kentucky.
Basic billing requirements for billing. There are several requirements must be met before a school district may request reimbursement from Medicaid. First things first, the child must be Medicaid eligible. Just remember, kids go in and out of Medicaid eligibility all the time, and it's best practice to get assigned parental consent on all kiddos. Don't worry, we're going to cover more details about parental consent shortly. For the traditional IEP program, the service must be listed in the IEP. In this case, the IEP deems medical necessity. For expanded access, it must be considered medically necessary. Last but not least, let's make sure the practitioner is on the KDE SBH annual application and is not being paid 100% federal funds. If a practitioner is paid 50% federal and 50% non-federal, only submit the non-federal portion on the cost data sheet to your billing agents.
Medical necessity has always been a hot topic. Currently, with the IEP program, as long as the service is listed in the IEP, it's deemed medically necessary. That's all about to change, but don't worry, we will guide you through this process. Right now, we know that a service must be medically necessary in order to bill Medicaid. CMS defines medical necessity as services that meet accepted medical standards or items reasonable and necessary for the diagnosis or treatment of illness or injury, or to improve the function of a malformed body member. The most important thing to remember is to keep backup documentation. Backup documentation may include, but is not limited to, detailed progress notes, evaluations, test reports, consultations, and records from other healthcare providers. This is a basic definition, but over the next couple of months, KDE will be working on more examples and specifics regarding medical necessity. Just hang tight and we will learn this together.
Here are two examples that meet medical necessity. A school conducts a screening for all students. The school may be able to bill Medicaid for eligible students. Another example is Johnny goes to see a nurse. Since he has Medicaid, the school may be able to bill for his visit with backup documentation. These are just two of many examples. This program opens the doors for so many possibilities and will hopefully provide the school with additional reimbursement for services that they are already providing.
So now let's talk about parental consent. Parental consent is required for both IEP and expanded access services. KDE and DMS have made a dual parental consent that covers IEP and expanded access services. Schools must use the standardized parental consent sign that KDE has provided. It may not be altered in any way. Signed parental consent must be obtained one time as long as the student is continuously enrolled in your district. If a child leaves your district for any amount of time, the district must get a new signed parental consent. Just a reminder, districts may not share parental consents. Also, once the signed parental consent is received, the school must give out an annual notice every year that they will be billing Medicaid. Just to let you know, the dual consent does not void the previous IEP parental consents. Unfortunately, sometimes parents will not give schools permission to bill. When this happens, the schools cannot bill Medicaid for that child. On the KDE school-based Medicaid website, there is a parental consent brochure and the dual parental consent in English and in Spanish.
Parental consent is one of the major core components of Medicaid billing. It is very important for schools to have policies and procedures in place to ensure every child that is billed has a signed parental consent. For example, Sarah is in 8th grade and she has been continually enrolled in your school district since kindergarten. The signed parental consent is from kindergarten. It was misplaced. Technically, DMS could recoup every claim that was billed for Sarah. In order to avoid this, we strongly encourage the following. Number 1, have an electronic copy of all signed parental consents. There are many ways to do this, but a lot of districts have had success uploading parental consents to Infinite Campus. Number 2, it is recommended that the dual parental consent is sent out to all students to be signed. This would allow schools the flexibility to bill expanded access at any time. Also, Medicaid eligibility is continually changing. If a parental consent is received on all students, then the school can bill as students become Medicaid eligible. Number 3, send dual parental consents home in the registration packets. This would allow the school to ensure every family has been given a parental consent. And number 4, have written policies and procedures regarding parental consents. Having everything in writing would allow every school district practitioner and employee to follow the appropriate procedures and make sure all of your I's are dotted and your T's are crossed.
To wrap up parental consent, here's a copy of the dual parental consent that schools must use to participate in the expanded access portion of the program. Please know that this parental consent does not void out the current IEP parental consent. Also, schools must use this parental consent and once again may not alter it in any way. Please remember that the parental consent is only valid from the date it is signed. You cannot bill backwards. This form can be found on the KDE Medicaid school-based website. We will provide the link at the end of our presentation, and both English and Spanish versions are available.
Here's an overview of some of the services that will be covered by the Medicaid Expanded Care Program. Currently, speech services are the most utilized service in the school district. With Expanded Care, DMS has now expanded their practitioner list and will include providers such as school psychologists, licensed professional art therapists, and several more. We hope that this will allow the schools to get additional reimbursement for mental health services they are already providing. For example, little Beckett's parents are going through a divorce and he needs help dealing with his emotions. He now goes and sees a counselor every week. This may be billable with expanded access. Also, expanded access will potentially allow schools a chance at getting more monies for the services their school nurses currently provide.
Here is a quick representation of the services that schools bill in our current IEP program. Please know that not all of the services on this chart will be available for expanded access. Of course, speech services are the most utilized service in the school district at 52%. Then transportation is at 16%, and occupational therapy comes in third at 15%. Unfortunately, with the current program, mental health services are only at 1%. We expect that with the program expansion, that will include a new expanded list of billable practitioners and services. Nursing and mental health will be highly utilized services in the school district.
Most of the services, minus a couple of exceptions, may be billed in either individual or group therapy. Please remember when billing group therapy, the group can only consist of 6 kids or less. If you are working with an IEP student, please remember to write small group or individual therapy in the IEP. KDE recommends it be written in the Supplemental Aids and Services or the LRE, the least restrictive environment. By putting this statement in one of these sections, it umbrellas all the services listed in the IEP. Please note that all services provided prior to June 30th, 2020 will be paid via Medicaid's physician fee schedule. Also, more importantly, prior to June 30th, practitioners cannot provide both IEP and expanded access services. Starting the upcoming school year, practitioners will be able to provide both IEP and expanded access services since the expanded access will be incorporated into the random moment time study.
The good news is that evaluations are Medicaid reimbursable, and most schools do not take advantage of this. You may bill all parts of the evaluation, including the testing, observation, and writing the report, as long as it's done during the normal school hours. Please note that during COVID-19, DMS has said that services provided outside the normal school hours are reimbursable. Evaluations must be billed the exact times they are provided. If you are providing an evaluation for little Aubrey and you observe her on Monday at 12:30, test her on Wednesday at 10 o'clock, and then write the report on Friday at 2, you will need to bill these exact times on the days they are provided. Most practitioners' licensure requirements say the evaluation should be no older than 3 years.
Since the program expansion, the procedure code list has changed dramatically. While the traditional IEP program only contained around 40 procedure codes, the new list contains hundreds of procedure codes. This is due to the expanded list of providers and services that the school will now be able to get Medicaid reimbursement for. Your billing agent will be able to help you navigate the new procedure code list. Also, most procedure codes are still based on units. FY, one Medicaid unit is 7.5 minutes to 15 minutes. There are a few services that will be reimbursed on a service base, but please know that even if the code is service-based, the time still must be listed on the service log when the service was provided.
Here is a quick slide that shows how the claims are calculated. Each procedure code, individual, group, evaluation have a different reimbursement rate and a different maximum reimbursable amount. Please refer to the formula below if you would like more details on claim calculation. Also, always remember the schools provide the state match, which is about 30%. So the districts will receive approximately 70% reimbursement.
Things to remember. Here are a few important things to remember. Once again, practitioners cannot be paid 100% federal funds. For example, if a practitioner is paid 50% federal and 50% non-federal, then only claim the 50% non-federal amount. Remember to exclude all federal monies when submitting cost data to your billing agent. Make sure you include all Medicaid billable practitioners on your KDE application. Also, please remember that all claims from now until June 30th will be paid on the Medicaid's physician fee schedule. From now until June 30th, no practitioner can provide both IEP services and expanded access services. Starting next school year, practitioners will be able to provide both IEP and expanded access services, since expanded access will be incorporated into the random moment time study.
Okay, we have a couple more questions, so we'll try to go through these. We have one question. Can you be more specific with what school sites can bill for? Tina, there is an updated procedure code list in the new SBHS Technical Assistance Guide that should be able to help you, but that'll be something that as we go through this process, we'll be able to give you more specifics. Do you have anything to add, Lucy?
No, I don't. The complete list is in the current technical assistance guide, but things are changing, and if there's anything that needs to be added, it certainly will.
Thank you. We have one more question. Are services from licensed social workers and/or licensed professional counselors eligible for reimbursement? So licensed social workers are on the modifier list, so some of the services will be eligible, and I'm almost positive licensed professional counselors are on there, but you would definitely have to check and make sure they're an eligible practitioner. Okay, now we'll get started with our quality assurance. Starting the 2021 school year, KDE will mandate that all schools have a KDE approved quality assurance on file. Quality assurance documents will detail out the school district's policies and procedures for their Medicaid school-based programs. This will allow KDE to determine program shortfalls and improve future monitoring reviews. For example, we know that a school needs to get a Medicaid parental consent. The quality assurance document will outline every step in that process, such as, number 1, dual parental consents are to be given out in annual registration packets. Number 2, all returned signed parental consents will go to the DOS. Number 3, the DOS or administrative assistant will put the parental consent dates into their billing system. Number 4, the original signed parental consent will go into the child's due process folder, and so on. Does anyone see how this process can be improved? Remember, it's best practice to keep all electronic copies of all parental consents. So the best way we found that schools do that is by uploading them into Infinite Campus. Schools are more than welcome to start submitting the quality assurances this year. This would allow the district a much quicker processing time and make sure the district doesn't miss the 2021 deadline. We'll be glad to help schools with these. Please reach out to us if any assistance is needed. Please know that there is a basic outline located on the KDE school-based website to help schools get started.
So your district's met all the billing requirements. So what's next? We request that every school district submit expanded access contact names to the school-based email. We want to ensure that all communications are sent to the appropriate contacts. Please remember that even if a district chooses a new point of contact for the expanded access program, the special ed department still needs to be involved. We want to make sure that special ed is helping guide the process because they have the most background in the program. Also, we are excited to announce that KDE SBHS annual certification application will now be submitted electronically. We are going to review the new process in just a minute or so. For best practice, it's always best to keep written program policies and procedures. It allows everyone to be on the same page, list expectations, and assist in training new staff. Hint, hint, this sounds a lot like quality assurance. This is the best time to start writing everything down and making sure all the program guidelines will be met. We will be glad to help you with this, just let us know. Last but not least, we all know that you can't start billing until you have a signed parental consent. This will be a huge task to undertake. Take your time, figure out your district's plan, and stay organized. This is going to be new for all of us.
Okay, we have questions coming in. So we're going to go ahead and answer some of these questions. The first question is who will direct questions come to as we move through the process next school year? Would it be this email address or an individual person? Okay, so you can either use this email address, or of course you can call myself or Lindsay. We'll be sure to give you our contacts at the end of the presentation. Also, Lucy Centers from Department of Medicaid Services is available to help too. Okay, what type of nurses are eligible to bill for services? Currently, Lucy, please chime in if you have the modifier list pulled up. We do, I know RNs are on there, but as far as specific modifiers, you will have to refer to the new updated SBHS Technical Assistance Guide for a complete list.
That's correct. All the modifiers are currently correct on the list. Again, they are subject to change as new services are added. So just keep in mind that we will update them whenever possible.
Okay, we have a question about nurses. Do nurses need to be under the supervision of a physician in order to be billable? No, for the Kentucky School-Based Health Service Program, they do not have to be under the supervision in order to be billable. I have a question. Is day treatment able to be billable or more intense therapy options for students? I do not know this answer, but we can look into it and get back to you. Lucy, do you have any?
No, I don't have anything to add about that.
I have a question. Who manages non-IEP consent forms? This is a district decision on how you're going to organize your program. A lot of the contacts we got from districts, you know, it was still staying under special ed, but then I've heard a lot of districts who are going to move the expanded access portion under the district health coordinator. It's just whatever works for your district. So that's something to think about, who's going to, you know, manage all the consent forms in your district. Great question. These are really good questions, so keep them coming. Okay, will the new billable practitioners bill through your current billing system or on paper? Your current billing agent will be able to bill your expanded access program just like you bill your normal school-based program. We will provide a copy of our PowerPoint, and this is being recorded, so you can refer back to it at any time. I did get an update, and I appreciate the help. The only social workers that are listed on our updated modifier list are certified social workers and licensed clinical social workers. I have a couple more questions. I'm trying to get through them all. Okay, for the expanded access, for expanded Medicaid services, how would it be handled if the district's contracts with another agency to provide the school nurse services? Just want to make sure it's clear that the contracted agency cannot be the agency that bills. Okay. How would it be handled if district contracts with another agency? If you contract with another agency to provide the school nurses, and they are not already billing Medicaid, then you would just need to have those contracted nurses submit claims in your current billing system. Just remember, with all contracted employees, it still falls under the school responsibility. So you want to make sure that you set forth good guidelines and make sure they're properly trained. They just keep coming. Do school psychologists have to be licensed, or do certified school psychologists also bill? So with the updated modifier list, Lucy, you can chime in if you, school psychologists are on there, and it's actually a certified school psychologist. So just check that out when you get a chance. That a lot of mental health providers that we were not able to bill for in the past will now be eligible for Medicaid reimbursement, which is really exciting. A couple more questions, and then we're going to continue on. Our district uses online registration, where our forms are online with Infinite Campus, and parents must click on them and electronically signed with a typed signature. Will this be acceptable? This is a great question, and right now, in the past, we have not accepted electronic signature, but this is something that DMS and KDE can explore, and we will let you know as soon as we have discussed this. If contracted nurses bill Medicaid for services, can the school bill as well? You cannot have two agencies billing for the same services, so you'd have to make sure that you guys aren't double billing. You would just need to check with your contracted agency to see if they're billing or not before you start billing in this program. There's a question about how the billing agent will determine the difference between parental consent from IEP and dual parental consent. That'll be something that all the billing agents will be glad to do training on, and they can answer specific questions about their system. We're going to take a little bit of a break from questions and go ahead on, but I will promise we will get to everybody's question. Okay. Here's a photo of the 2020 application. Ms. Thelma Hawkins will demonstrate how to submit your application electronically. The new application will be available only through GMAP on May 26, 2020. We will send an email notification along with directions out as soon as it's available. Importantly, the application for the upcoming school year will be due by Monday, September 7th. Please remember that all applications must be submitted in GMAP by September 7th. If an application is received after the deadline, their provider number will not be backdated to August 1st. It will be backdated to the date the application is received. Also, the sooner the district submits their application, the quicker the processing time will be. Ms. Hawkins will go into more detail, but all licensure certifications must be uploaded in the order they are listed on the application. Failure to do so will result in KDE requesting you to resubmit and further delaying the process. Last but not least, the application includes a place to tell us if you will be participating in the Expanded Access Program. Please make sure to mark the checkbox if you will be participating.
KDE has made our new GMAP application more user-friendly to districts. Also, the GMAP application will fulfill the recommended guidelines for Healthy at Work. We hope everyone is excited about our new process. Now we're going to turn it over to Ms. Thelma Hawkins to help us through a little demo.
Okay, I'll share my screen. Okay. Can you all see can everyone, well, Lindsay, Stephanie,
Yes.
Can you see the GMAP homepage?
Yes.
Okay. So as Stephanie and Lindsay stated, beginning with 2020, 2021, the school-based health services annual application will be submitted in GMAP. For those of you that wear multiple hats in the district, the GMAP application system is our online system, which is primarily used for districts to submit their federal grant applications for Title I, Title II, Title III, Title IV, Title V, Perkins, and IDEA, and we also use it for several federal reports. So the system is pretty much user-friendly, and as they stated, you will receive step-by-step directions. So first, to obtain access to GMAP, you would need to contact your district user access administrator to have that individual set up you a username and assign you the role of district Medicaid application update. And if you have, if you are in front of your computer at the moment, the user access administrator list is listed in, there's a list of the district user access administrators listed in GMAP under KDE resources. And you just click on this list and it has a list of all the districts. Just about we have a couple of districts that do not, we've asked them to submit a name, but if for some reason your district is not on this list, you can contact, click on the KDE contact and either call one of these numbers or email this GMAP help email address, and we will be able to set that up for the district. So once you log into GMAP, and logging in is basically with your email address and your password. So you will log in. Okay. I'm logging in as the administrator. However, when you log in as a district, you will see all of your district information. You will see your district name, your district number, and it will also have some announcements. So this is what it looks like for me as the administrator. So I'll get to, so I'm gonna get to, we have a test district that we use for training. So I'll get to that, but you won't have to, this is a long way for me, but you won't have to log in this way. When you log in, like I said, you'll see your desktop with your district information, and this over here on the left side, this legend, when you log in, you will need to click on District Document Library and select the year, and then click on Search, and this will show all of the folders that are available for different uses. And so down here, you see the Medicaid application. So to submit your annual application, you will click on Edit Documents. And this and it'll take you to this screen. And this document template is the annual application. And so the spreadsheet of the annual application will show up. And you will, so that's the annual application. You download it so that you can start entering in the information for all your practitioners. And once that's completed, you will save the document. And in the instructions which you receive from Stephanie and Lindsay, they will have instructions on how to name that file. So let's say you've already done that. Once you have the application, that annual application with all the practitioners listed on it, you will click on Upload Document. And for this purpose, we're just going to call it the SBHS certification application. You have to put a document name and document description in each one of the boxes. And so you go and wherever you save that document, you'll upload the application. So this is just, you click on Save, and then you click Return to District Document Library. And right here, you will see this will date and timestamp who uploaded it, the date, and this will be the application. So when Lindsay and Stephanie, when you've uploaded it, Lindsay and Stephanie will come here, click on this, and that will be the document which you uploaded. So that'll be your annual application. So that's where you submit your annual application. The next item you would need to upload is your certification and licensure. And as Stephanie mentioned, your licensure needs to be in the same order which you listed the practitioners on the application, because since everything is going to be online, to avoid them having to sort through, well then everything needs to be, the licensure needs to be in the same order as the names you have listed on the application. And to do that, you just click on Edit Documents, and you can, you'll scan it as a PDF file, and you just click on Upload Document. And once again, you have to give it a file name. Just here. And then we're going to go in whatever you name that file. So certification and licensure, click there, save, and then return to your district document library. And then, whoop, wrong one. And there. So this is the document which you uploaded. So and its date, once again, everything will be date and time stamped with the name of the person who uploaded it. If for some reason you need to make a correction, you failed to upload some of the certifications, you would just go through the same process again. Just uploading, click upload, name the file, and just upload the document a second time. You can just upload the document a second time, and it will have the second document you uploaded. And so it'll show both documents. You will not be able to delete what you previously submitted. It records and saves everything which was uploaded. Then once Stephanie and Lindsay review your certification and licensure and your application, they will upload the approval letters here. And so once again, this is a step they will do. Okay. And then that's your approval letter. And any for amendments, and you would just click on this, that's your approval letter. And so the same process is the same for amendments. So for amendments, there's a separate, they're going to track that separately, and you would just go through the same process. There's a template for the amendment form. That's up there. You click on that, download it, complete it, then upload the document. Just gonna call it. You always have to provide a file name. Oops. Let's see. And the same thing, oops, let's see, amendment. Oops, no. So this is an amendment form. And so any amendments would show up under here. And like I said, Stephanie and Lindsay will come up with a naming mechanism of how each document should be named. And then for the approval letters, all approval letters will be kept in one section. And so the file name may be SBHS approval letters, amendment, and a date. But all approval letters will be under the SBHS approval letters folder. And for the quality assurances, once additional instructions are provided on that, we don't have a template for that, but it'll be the same, just a matter of whether it's a PDF file, a Word file, an Excel file, whatever your document is, you would just upload the document. And upload the document, have a file name. Oh, I didn't do one for, but we'll just do this. So, but when you upload it, it will be here, and Stephanie and Lindsay, all they have to do is click on that document to look at it. Now, the one thing that this system, because of the way we're using the district document library, once the approval has been granted, they will have to send you an email to notify you that the application has been approved, and you would need to check GMAP. Unfortunately, notification alerts are not tied to the district document library. So this is just a simple process of going electronic, so to speak, for submitting your annual application. However, the one thing you can do to get started is contact your district user access administrator and have that individual set you up in GMAP. Now, if you're a director of special education, you already have GMAP access because you have to complete your IDEA application. So what you would need to do is contact your user access administrator and have them add the role of district Medicaid application update to your user email. And that's just a simple process. But once again, to figure out who your user access administrator is for the district, it's located in KDE resources under user access administrator. And you do not need to have GMAP access to access that KDE resources. If you go to the website right now, which is gmap.education.ky.gov, and you go to the home page and click on KDE resources and then user access administrator, you can see who your user access administrator is for your district. Do we have any questions about the GMAP?
Thelma, we have several questions coming in. I think I'm going to wait. We just have a couple more things to go over because I can't sort them out, and we'll just go over the questions in just a few minutes and get to everybody's.
Okay, so I'll stop sharing. Hold on. Oops.
Thanks, Thelma.
You're welcome.
All right.
Okay. Be cautious of contractual agreements. Please remember that Medicaid reimbursement is only meant to cover a small percentage of the school's actual cost. We want to make sure that schools don't get over their head and are making financially sound decisions when it comes to this program. Also, it will take you at least 2 years for a school to see how much reimbursement they are getting. Remember, you get reimbursement through all 3 programs, and these amounts cannot be predicted. Please reach out to us if you have any questions or concerns. We're always here to help. Also, please stay in contact with your billing agents, and together we will navigate this new program. One more exciting announcement. Our new updated SBHS Technical Assistance Guide, Dual Parental Consents, are now available on our KDE school-based websites. Be sure to check them out. We hope to see you this fall at our Medicaid trainings.
Later this summer, KDE will be conducting our next webinar to assist schools with the program expansion. So keep an eye out for our webinar on school-based best practices. We will also be sending out an email when the annual application is available on GMAP.
As promised, here is everyone's contact information. Please don't hesitate to reach out to myself, Lindsay, or Lucy at any time.
Here's our KDE school-based website. Please remember our updated SBHS tag is available on our website along with this presentation. We hope to see everyone soon, and please stay safe and healthy.
Okay, now we're going to get to the questions. Thank you, everyone, for submitting all your questions. I really love that you guys have so many good questions to ask. And will there be any change to transportation billing due to expansion? Example, student receiving expanded mental health services, nursing, etc. Or will transportation continue to be billed only on days when students receive IEP billable services? To my knowledge, transportation is not going to be eligible for the expanded access part of the program, but you can still bill specialized transportation for this IEP children. If time-based sessions have to be at least 7.5 minutes long, does that mean we need to track seconds when working, helping students? We don't ask that you track seconds, but we just say, if a service, just round up to the next minute. So if it takes you 8 minutes, then you put the service takes you 8 minutes and it would be billable. If it only takes you 30 seconds, then that would not be a billable service. If our nurses are contracted from an outside agency, can we bill for their services through SBAC? I'm not sure if you're referring to SBAC or billing. If you're paying nurses, as long as they are not paid 100% federal funds, and then you are able to bill for those services, but of course they cannot be billing themselves, or that would be a duplication of billing, which is not allowed. Do we need a copy of each child's Medicaid card? You do not need a copy of each child's Medicaid card. Will sample policies and procedures be provided? We are getting ready to do our best practice webinar later this summer. So we will try to include some sample policies and procedures. But if you're referring to the quality assurance, I will be glad to walk you through that process and help you in any way possible. Please remember, we're all learning this together. So I'm sure as the expanded access starts, we will improve our policies and procedures as we go along. How does the school determine if the provider is paid by federal or non-federal funds? This would be something that you would ask your finance officer on how they are being paid. Is this an accounting classification, or does the school district need to have separate bank accounts? The school finance officer would know all these questions, and they document it usually through their own financial piece of software called Munis. Can certified school counselors submit for reimbursement? Once again, all the new expanded list of modifiers are in our SBHS technical assistance guide. So after we get off this, you can go onto our website and pull up that guide, and you'll be able to see everybody that's eligible for reimbursement. Will we be adding more staff to random moment time study, even if not a Medicaid student, because of the new students added? You guys will get all the information you need for the SBAC program in the fall in training. So just hold all your questions for SBAC and you will get training on that. Please explain the supervision of nurses again. Okay, nurses in the school setting do not have to be supervised by a physician. So an RN can bill. I know there has been discussion. Lucy, if you feel free to chime in, there has been discussion on what services the school nurses can bill for in the school setting. But I do know that, you know, if little Johnny goes to see the nurse because he's not feeling well and the nurse treats him and you're participating in expanded care and he has Medicaid, then that service would be billable as long as the other billing requirements are met. If a Medicaid eligible student is evaluated for special education services but does not qualify for services, is the time spent completing the evaluation reimbursable under expanded access? So the service has to be available to all students free of charge. So off the top of my head, probably not, but that is something we would be glad to explore and get you a specific answer to that question. If we only do consents at ARCs, do we need to all assign the new consent form? So if you're only going to be participating in the IEP portion of the program, then you do not need to get new consents formed, new consents signed. But if you are going to be participating in both the expanded access and the IEP portion, then it would be our recommendation to get the new consent signed for all your children, just because we don't know which children can go out of Medicaid eligibility. Also, some of your kids that are IEP kids may also receive services through the expanded access. So yes, if you're going to be participating in all aspects, the IEP and the expanded access program, then it would be advisable to get the new dual consent signed so it covers you. Yes, the webinar that we are doing on May 29th will be the same as today's. Can you explain in more detail what we need to be cautious about for contractual agreements? We always want to make sure that schools are not, you know, entering into more than they can afford to pay. We know you'll get additional reimbursement for the expanded access program, but we don't know how much reimbursement that is. You know, you could have to pay a staff $80,000, but you may only recoup $10,000 of that through this Medicaid program. So just be cautious that you guys can afford, you know, the contracts that you're entering into and doing what is best for the school district. Will there be training provided on telehealth services? We need training for our staff and on what is billable telehealth service. So currently, CHFS, which is Cabinet for Health and Family Services, the Department of Medicaid has a telehealth work group. They are working on helping the state with telehealth questions. Lindsay and I will not be providing information on telehealth, but we do advise that each practitioner contact their licensure board to see what is eligible for their licensure for telehealth. Thank you guys for all the questions. That's all of those. And if you have any other questions in the future, please just reach out to Lindsay, Lucy, or I, and we will be glad to help. We really appreciate everybody coming and are just really excited about what this new program has to offer.
Thank you all.